Hi
Hello.
everyone, we're Pup Support, and today we're going to be giving a presentation on men and mental health.
So, mental health is really important to talk about men because it's as important to women as it is to men. There are societal stigmas that exacerbate these uh, problems with men and mental health. And so, this can affect accessibility to resources and allowing people to have comfort with expressing mental health concerns. And that can include seeking support from surrounding peers. And so, to give an example of this, having depression is often seen as a sign of weakness in males, and therefore it would be demeaning to their manhood to mention problems with mental health. And so, byproducts of these stigmas that we see are that there are underdiagnoses of mental health conditions in men and um, making them more susceptible to suicide and self harm and having bad coping mechanisms. Additionally, there are major problems with their current diagnostic system. Our current diagnostic system is the DSM-5, and it excludes sex disparities in mental illnesses. And so, to give an example of this, doctors are more likely to diagnose women with mental illness more than men, even though the prevalence of mental illness may say otherwise. And prevalences of anxiety and depression diagnoses are higher in women, whereas substance abuse and antisocial disorders have higher diagnoses in men. So, in this, to give an example of this, a study by Martin et al. Analyzed the experience of depression with men and women. They used two symptom assessment systems, a traditional method, which would be the DSM method that we currently have, and the alternative methods, which are including the symptoms commonly experienced by males with depression, and that can look like coercive behaviors, signs of aggression, and uh, problems with social behaviors. And historically, the traditional method has also found that women who are diagnosed with depression um, are diagnosed at 2 times the rate of men. And so, what they ended up assessing was the alternative method and a combined method with traditional and alternative methods. And so, using the alternative method, it was noticed that there was a higher percentage of men that were diagnosed with depression, the 26.1%, compared with 21.9% in women. And then using the combined method, they saw little to no difference, showing about 30% in each gender being diagnosed with depression. And so, one discussion question that we came up with, and just to sort of think about on your own, is what do the results of these studies suggest, and why do you guys think that it's important to talk about men and mental health?
So, there's a phenomenon called the gender paradox in suicide, and this is a phenomenon that is mostly found in Western nations, that women are more frequently reported as having suicidal ideation or having attempted suicide, but men are more frequently reported as dying by suicide. And reasons for this, it's suggested that men more often use more lethal methods of suicide attempt, such as firearms. Men are actually reported as using firearms at twice the rate of women for suicide attempt, while women are more likely to use less immediately lethal methods of suicide attempt, such as poisoning or overdose. It's important to keep in mind that this type of reporting is subject to bias, and uh, one community that is possibly largely underrepresented for non-fatal suicide attempts is prison populations, which are largely male, about 93% male, actually. And then this graph, this diagram, kind of just demonstrates this gender paradox. It describes suicide rates and methods in men and women, male and female veterans. And you can see that in both sexes, firearms was the most prevalent method of suicide, but for men, this was occurred at almost twice the rate of women, whereas poisoning, which can include overdose, was much more highly represented in females than males. Now, this distribution of suicide attempt and method is fairly comparable between veterans and civilians, but it is important to note that veterans die by suicide at twice the rate of civilians. So these veterans are also another important population to keep in mind when we think about mental health and suicide. And now we're going to talk a bit about the stigma surrounding men and mental health in more detail.
So in our society, there are many stigmas that surround males and that can exacerbate mental health experiences. And so, one of the major stereotypes in our society is called toxic masculinity. And that what this means is there's cultural pressures for a male to present themselves and roles of domination, aggression, emotional strength, and self reliance. And so, a prominent example of this is that a common stereotype is that men are strong, and because of this, vulnerability in males are usually discouraged. And so what this can pose problems for is having difficulties with emotional articulation. And so that can evidently be harmful to being open about mental health struggles and really um, seeking help with mental health professionals. Additionally, it also poses damage to process stronger and new emotions, and this can lead to faulty coping mechanisms, such as having attitudes of aggression towards others when unnecessary. And another example of toxic masculinity is men get mad, not sad, and sort of the emotional phenomenon that men don't feel anything but aggression. And this affects social support from others, affects the social support they receive from others, and that can obviously exacerbate their mental health experience and their willingness to go seek mental health care. And so, in a Purdue study about gender stereotypes, they found that gender stereotypes affected how one responded to a person with mental illness. And to give a prominent example of that, the study they showed that a male showing aggression was more likely to be labeled as a substance abuse diagnosis rather than a depression diagnosis.
And going off of that, there are a few mental illnesses in our society that have been gendered in a way that they are seen as stereotypically feminine, per se. And one of the most prominent and well-known examples of this is eating disorders. In our media and, uh, general conversation, eating disorders have largely been associated with uh, young women and girls, particularly. We've seen, very representations of skinny, white girls struggling with eating disorders. And of course, eating disorders can affect anyone um, of any shape, size, or gender. And statistics say that actually 1 in 3 people struggling with an eating disorder is male. Uh, and additionally, disordered eating behaviors, which are harmful eating behaviors that are subclinical or don't quite meet the criteria for diagnosis of an eating disorder, such as binge eating, purging, laxative abuse, and fasting for weight loss, are nearly as common among men as they are among women. So this kind of portrayal or idea that eating disorders only affect women, or even within that a specific look or type of woman, is patently false. Additionally, anxiety is another mental illness stereotyped as feminine, but 1 in 5 men will experience clinical anxiety at some point in their lives, statistically. Anxiety can look very different in men compared to women. It may manifest more in physiological symptoms such as fatigue, nervousness, or aggression, as well as alcohol or substance abuse, and again, anger. As Christine was talking about a bit earlier, depression is also something that affects men, obviously, and there are a lot of barriers to seeking help for depression in men because, again, there is a stereotype of depression as feminine or only affecting women. And as she was saying, depression can manifest in a very different way in men compared to women, such as in loss of interest in daily activities, rage, risk-taking, and substance abuse, instead of what we might generally think of with depression, which is sadness and guilt, which may be more likely seen in women. And as already talked about, this idea of traditional versus gender inclusive depression scales influences how we recognize and treat depression and other mental illnesses. And it's important to keep in mind that how we see mental illnesses and who we see mental illness in is largely dependent on how we diagnose mental illness. And uh, there is a chance that maybe we are missing depression in men because we aren't including symptoms that only manifest in men. And so another question that we wanted to pose to everyone is, why do you think specific mental illnesses get gendered in this way? And how might this affect both men and women detrimentally who live with these mental illnesses?
And speaking about men and mental health, it's also important to mention the men in colors. Um, and what happens there is that there's lots of instances of racial prejudice and stress exposure in life. And what that can cause is higher risk for developing mental illnesses. And so, to give an example of that, African American men have increased chances of being incarcerated, unemployed, and experience childhood adversities. And as you may expect, being incarcerated doesn't do greatly with your mental health, and being unemployed does not do greatly with your mental health. And also, childhood adversities can also exacerbate your mental health concerns. In addition, racial prejudice and stress exposure in life can also lead to a lot of distrust in societal constructs. And to give an example of that, that could manifest in um, medical distrust, and that can cause delays in preventative mental health screenings and prevent one from seeking mental illness facilities to treat their mental illness. Another thing I wanted to mention was the model minority stereotype in Asian Americans, which often doesn't get a lot of attention in media. This is a stereotype that all Asian Americans are successful, non problematic, and law abiding citizens. And so once this uh, stereotype is sort of not applicable to an Asian American, they're often seen as not successful, or often seen that they are a disgrace to their family almost. And so I think that can take a large toll on their mental health. And being this imperfect individual can often be um, sort of looked at negatively by your family. And so, another example of this is having the number one son stereotype. It's common in Asian households to really prize and praise their firstborn if they are a son. And that puts a lot of pressure on the firstborn to sort of be successful in life. And if they aren't, sort of make them feel like a failure. And so, yeah, these stereotypes that stem from the model minority are really prominent in how Asian Americans often, especially men who often don't seek mental health, um, don't seek mental health facilities or treatment for their mental illnesses. Another thing I wanted to mention was this intervention for men of color. It's called My Brother's Keepers Initiative, and it was proposed by Barack Obama. And the essential goal of this intervention was to promote young boys of color to reach their full potential and emphasize social behavioral support. And so, what that can look like is implementing more mental health training in early education and sort of increasing the comfort in our society with mental health conversations. And they really focused on that social behavioral aspect of the men of color's lives. And then a statistics I wanted to share from this intervention that they found was that more than 90% of detained youth experience comorbid mental illnesses, and that can look like depression and PTSD. So, this is just an example of how there are interventions in our society that really try to combat the problems with men and mental health. And hopefully, there are more to come.
So, how can we provide more support for mental health for men, or how can men seek to support themselves in their mental health? Well, one of the most important ways we can support our mental health or help others is by promoting mental health literacy. Recognition, management, and prevention of mental illness crises starts with education, knowledge, and it's so important for people to know what to look for so that they can seek help or help other people find help. And additionally, studies have found that increasing the visibility of male role models who are living with mental illness and seeking help for mental health issues can really increase the help-seeking behavior of men when it comes to mental health and mental illness. Additionally, action-oriented mental health interventions may be more appealing to men than traditional talk therapy methods, which may be more appealing to women. So, for example, coaching types of interventions or cognitive behavioral therapy action plans may be helpful in that they are more focused on proactivity and taking control than, talking about feelings. And that may be more appealing to more men than others. And of course, one of the best things we can do for anyone when it comes to their mental health and when it comes to ourselves and our own mental health is providing compassion and encouragement, having a bit of grace for yourself and for others, empathizing and pushing each other and encouraging each other to get that help and take that first step. A few resources to share are Man Therapy, which is a website that provides mental health testimonials, Q&As, and other online and local resources for men and their mental health, with a good dose of humor along with it, as well as Movember, which is an organization that seeks to raise funds and awareness about mental health and suicide prevention in men, as well as for prostate cancer and testicular cancer. And then American Well, BetterHelp, and Talkspace are all online therapy resources through text or video chat, which provide more accessible means to get professional help. Here's a list of resources that we've used for our presentation and research, and they will be available to you in the description if you'd like to know more. Thanks.